Itentive's webinar. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Itentive. Before we get started today, I just wanted to go over a bit of the housekeeping notes. I do want to mention that this webinar is going to be recorded, and we'll also be sending out a copy of this recording along with the slides within the next week. So I want to share a bit of who we are with you. Itentive has been in business since 2003, but we've been NextGen users since 1997, which if you're keeping track was EPM version 2.3. We specialize specifically in next-gen healthcare, and our goal in life is to make delighted clients by helping them get the absolute most out of their next-gen software investment. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen. And we also have two next-gen add-on productivity solutions, ChartGuard and Refund Manager. Next, I wanted to mention that we have an upcoming webinar. It's going to be on June 14th, and that covers introducing the newest member of the next-gen product family, MetaTouch. We're going to be sending out more details and an invitation to that in June, so keep your eyes out for an email from us on that. Okay, so back to today's webinar, using familiar tools for patient engagement and outreach. We're going to take questions at the end, but you can type questions in the webinar control panel whenever they occur to you, and for audio clarity purposes, everyone's phone is going to remain muted. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions in the questions area. Okay, so presenters for today's webinar, we have Lindsay Lanning, who is Healthcare Compliance Consultant at Itentive, and Cindy Kincaid, who is Vice President of Consulting Services at Itentive. So Lindsay, I'm going to go ahead and pass it off to you. Please feel free to get started when you're ready.
Great, thank you, Chelsea. All right, hi everyone, and thank you for joining us today for our webinar, Using Familiar Tools for Patient Engagement and Outreach. As the world of digital technology transforms, the adoption of patient engagement solutions continues to increase and help facilitate a better patient experience. So what can your practice do to attract new patients and advance outreach? The answer really is a lot, and most of these things you already have access to or the ability to do. So in this webinar, we will not only explore traditional patient engagement tools such as appointment reminders, statements, and collections. We're also going to look at the impact automation can have on population health and other quality care programs and initiatives. These include services such as patient satisfaction surveys, real-time scheduling, patient outreach, population health integration, and so much more. We really do understand the pressure from not only your patient population, but also from your competitors in the healthcare arena to transform traditional business practices into digital delivery. So stay with us today as we go through how to use these tools you already love in a new way to attract and engage patients. One thing I do want to point out is that today's webinar will be solutions focused. And what that means is we will be looking at solutions multiple vendors offer for patient engagement. We won't be mentioning organization names. We will just be presenting the products and services available in the industry right now that your practice can take advantage of. We really wanted this presentation to be informational and hone in on solutions to automating your practice outreach functions. So first, we're going to look at messaging and voicemail options, appointment reminders, letters and cards, and even patient surveys, just to name a few. We will also look at online patient scheduling, which isn't necessarily patient outreach, but it is automating an otherwise manual process to increase patient involvement and keep your practice in a competitive position in today's industry. And finally, we will look at creating better financial results with electronic patient outreach for revenue cycle management. So I keep saying patient engagement. But what really is patient engagement? Well, to start, according to HIMSS, patient engagement is providers and patients working together to improve health. Now, another source explains patient engagement as a concept that combines a patient's knowledge, skills, ability, and willingness to manage their own health and care with interventions designed to increase activation and promote positive patient behavior. In my mind, patient engagement has two parts. The patient who's willing and able to participate in their care, and then the physician who is providing interventions or ways to promote that participation. Now, regardless of definition, I think we can all agree that patient engagement is a term being thrown around to describe almost everything, from patient portals to social media strategies, from tracking vitals with wearable devices to really anything patients are doing to actively participate in their own wellness. So while we may not have a set definition for this idea, what matters is that everyone seems to be talking about it. And then there's the phrase that usually follows close behind patient engagement, and that's patient outreach. So what is patient outreach? Well, Wikipedia defines it as an activity of providing services to any populations who might not otherwise have access to those services. Another source describes it as reactivating patients already in your patient population. Now, I personally like that second definition with the key word being reactivating. That really is what patient outreach does. It attempts to reactivate patients to participate in their care in some way, shape, or form. What are some examples of patient engagement or outreach in healthcare? Well, there's a lot, and they include patient scheduling, automated appointment reminders, automated patient letters and surveys, electronic statements, even automated patient eligibility verification. Honestly, there are so many opportunities to communicate critical information to patients and providers. These types of tasks don't always have to be burden on physician staff. They can be automated using tools you are already familiar with. Communication is crucial to effective patient care and disease management. And automated healthcare tasks have the opportunity to improve quality and minimize potential waste in both cost and time. So why do you need to take advantage of these tools, or why do you at least need to consider it? Well, for starters, automating paper-based tasks frees staff to concentrate on higher value tasks. It provides them with the tools to be more productive, which leads to cost savings and efficiency. Also, growing your practice should include taking advantage of technology to maintain a state-of-the-art online presence. Expectations for convenience and instant scheduling are here to stay. In the end, it really is a strategic business move and a win-win outcome for you and your patients. Now, I mentioned growing expectations of convenience in the healthcare industry. And it's true, there's a new normal in our industry now. There's a shift in healthcare toward consumerism, explained Jordan Pisarcik, who is the Vice President of Business Development for DocASAP. Patients expect convenience and a certain level of service, so healthcare systems are responding by being much more service-oriented. According to Pisarcik, 72% of patients want the ability to book and manage appointments online, but most online solutions don't meet the demand. This makes sense. As the use of mobile devices and technology continues to expand, it seems pretty logical that medical practices should offer a means to directly connect a patient with their provider. Now, the primary driver of this new normal is the millennial generation. From the patient's perspective, reaching someone to make an appointment requires up to 8 minutes, with 30% of the time on hold. For the millennial generation, this can be a deal breaker. Millennials, ages 18 to 35, have always had access to online information. They dislike traditional methods of healthcare. 71% prefer to both schedule online and to receive digital reminders rather than by phone contact. Clearly, these tools and services are becoming a larger, more critical component in healthcare practice operations. So let's start with one very important part of that, engagement.
Hey, Lindsay? Lindsay, can you hang on for a second? You're breaking up a little bit.
Sorry, no problem. How do I sound now?
Talk again if you would. I think you're probably okay now.
If it's good now, and I'm actually going to go ahead and turn it over to Cindy for the rest of the presentation, so hopefully her
perfect. Good timing. Thank you.
Yep. All right. Thank you, Lindsay. By the way, we're both in the same office, so hopefully you can hear me. I don't know if we've got a bandwidth issue. It has been raining today, so we'll see what happens, but hopefully you can hear me. At any rate,
okay.
I'm going to take it over and talk about some of the actual options that you have and to give you some actual experiences as to how we improve patient engagement through automated patient outreach. So some considerations that you need to keep in mind when you are looking into up. So you want to consider the following to help boost patient engagement. First of all, find out how your patients want to connect with you. What is your demographic? Depending on your specialty, it can be very different. An OB-GYN office may have a very obviously a younger type of environment, and they're definitely going to want to have more automated access, whereas if you are working in a particular specialty that maybe creates a lot of efforts with your Medicare population, you might want to be a little bit different, but I have found they also want to have automated outreach. Be consistent with your communication on how you're delivering this. And ask your patients questions and value their feedback. If they like something, if they don't like something, if they make a suggestion, consider it. They're the people who are going to be using it. And then finally, consider their lives outside your office. And once you've looked at all of these items, then you can decide what messaging solutions work best for your patient population, because there are a lot of them out there. As you start looking into this, you'll find that, you may be thinking of things that are NextGen. We obviously work very closely with NextGen, but there are a lot of different options available to you within the NextGen family and externally to the NextGen family. Once you've made a selection and you're looking at automated messaging, there are multiple types that you can deliver. You can go with the traditional phone call and voicemail. You can text, and you can email. Delivering messages tailored to the individual patients directly can increase their engagement and quality of care. So when you're picking these, again, you can do any or all of these and deliver different methodologies. And in a good system, you can even pick and choose which ones you want to use when. We'll start with auto calling. The first thing you want to decide when you're looking at options is, first of all, your call windows. You can specify time frames to reach certain patient populations and optimize the calling. For example, patients that are retired more frequently answer calls during the day versus working families who are more likely to answer in the evening. So again, going back to your specialty and your demographics, you want to consider that in making your time frames and setting these up. You set your earliest and latest call times. You create a unique call schedule for certain days, such as weekdays only. And then you can do call staging. It allows you to control timing and volume of when the calls are placed. The reason that this is important is that if you're doing all of these on a Monday, you're going to increase your response time to people calling in your office, so you want to stage these in a manner that allows you to control your workload. The worst thing that you can have happen is send something out that's going to induce a lot of calls into your practice and then not be able to take those calls. Then you can set up your auto voicemail options. So you can first of all look at standard versus customization. You can create unique planned messages for each recipient using specific contact data, dates, and times. You can do a text-to-speech. There's no need to re-record. Just type out what you want the voicemail to say. These are kind of nice. I've received these, and it's probably easy from your perspective in setting them up, but I have to say, listening to them, sometimes I like to have that voice because I really don't always like to hear that a computer is talking to me, but at the same time, it is very efficient, so that's something to be considering. You can do a voice recording. That's what I prefer to receive anyway, and it's recording a message in your own voice or in someone's voice. And then you can also want to have a system that creates voicemail detection, so it prepares 2 separate messages per patient depending upon whether they answer or not. So in that case, you want to have the ability to say, okay, if you've got a real person, this is what the message is going to sound like. But if you're getting a voicemail, you may want to have something, please call back or please hit or something of that nature. And the reason for this is you want to be sure that you can leave a message and you're not cut off, so that your messages are actually being delivered regardless of what happens at the other end. Now, text messaging is becoming increasingly popular, and right now is by far, I believe, more popular than leaving the voice messages. And I, again, prefer to receive those, and I've had a couple of instances lately where I've been involved in a physician's appointment where I've gotten text messaging, and that's really very helpful. So first, you can give on-demand messaging. It's any relevant message or update regarding care. I've received text messages from my provider telling me that my lab results have been returned or something of that nature and alerting me to get into the portal. Those are types of things that you can be looking for. You can also send text messages in terms of appointment reminders, and you can do customer mass text for certain days. Just-in-time messaging. I recently had the pleasant experience of having that when I had to go to an urgent care when I was out of town, and it was really interesting where I would get messages saying, okay, you're getting close, you need to be here in 15 minutes, your appointment is available now. Patient satisfaction surveys are a new phenomenon being added. As many of the quality care initiatives are requiring you to do patient satisfaction surveys, you can do individual or mass surveys regarding patients that have been seen within a specified time frame, and that should then be able to meet your quality care initiatives or your macro initiatives, whatever program you're participating in. And finally, a new functionality that I've seen with a lot of the systems that we've been looking at, you have your population health systems, and those are really great, and you can use a lot of things with those, and I've certainly encourage everyone to look at those. I'm a firm believer in that. However, a way to kind of dip your toe in the water is that you can use some of the voice reminder systems, and you can create individual text based on your EHR integration or mass text as part of a population health campaign. Perfect examples are you want to send text to your patient base when the flu shot campaigns are on. Perhaps if you've got patients over a certain age and you have a system that's capable, you can send out about pneumonia vaccines. Another example is that if you've had any particular diagnosis, you can just send a gentle reminder, have you had, say, a follow-up for your hypertension recently? Now that can be a little bit tricky. You know, you may want to get into a more detailed population if you want to get that level, but at the same time, if you can base it on diagnosis, you can do some gentle reminders that actually allow you to engage your patients more simply by sending them text messages. And you'd be surprised at how well that works. On-demand messaging is another area, and this provides the ability for practices to send an update or a message to a single patient or a group of patients based on a provider, a schedule, appointment type, or time range. Some examples can be time delays for all patients scheduled for a certain provider. Very useful in an OB-GYN office. You maybe need to send a message saying that the provider has had to leave the office for a delivery and they may be running 2 hours behind schedule, 4 hours behind schedule, or even to let them know, alert them that they will be seen by a different provider today if you've got a coverage, or they might be seeing the nurse practitioner. Just something that you want to let your patients know, and that's what is a kind of an on-demand messaging, something that a certain event has triggered. Unexpected closures due to inclement weather. I was at a practice a few weeks ago in Michigan that had a severe windstorm, and the system that they were using had this ability, and it detected that the offices had to be closed, and it sent the messages out, but it redirected all the patients to call a certain number to be able to not just reschedule, but actually perhaps even get in with a different location if they chose to do that. And then everybody kind of got on board with the program, and it was really kind of interesting to watch as that happened, because I happened to be there in the power outage, and it was you know, really kind of a interesting display as to how this might work. And then emergency closers. If you have a water outage, a power outage, something that would eliminate you from seeing the patients, you could actually send messages to your patients, and sending text messages or, you know, voice messages, or however you're choosing to do it. Again, you want to have those choices, perhaps all three, to make sure the patients get them. Then this is the ability to be able to do that. Here's a couple of on-demand messaging examples that we've been able to do. So in this particular case, pick a message. It has inclement weather. You ask for the date range, and we put in the date range, and then it's simply the message that you put in. The system currently has appointment data from January 29th to January 30th. Please choose the date range. That's just how you would set it, and then the contact date and time. And then if we move to the next example, what that will allow you to do is then you would get this message that would go out to everyone, and that would allow you to send the message to everyone, and it's just as simple as that kind of setup. If we move into automated appointment reminders, the healthcare industry continually faces the challenge of patient no-shows. Most of the groups I've worked with have always expressed that this is a problem, and it's a problem that costs money, and it's also a problem which makes up the most significant loss of revenue to healthcare providers. Automated appointment reminder solutions provide practices with the ability to send these reminders to patients via email, voice, and SMS text messaging. If we look a little closely at some of the solutions, it has many different forms and capabilities to fit your individual needs. These can include voice, email, and text reminders for printing appointments, same-day reminders, no-show messages for missed appointments, and that's pretty important as we get into some of the liabilities associated with patients that don't show and don't follow up, particularly depending on the nature of the appointment. So this is actually an area that can also be considered more than just a revenue enhancement. It's also a health or an outreach enhancement, allowing you to be able to say that you've missed these appointments and let's get it rescheduled regardless of your reason. Just-in-time messages. This is nice when you've got a provider running behind, or even if the provider is on time, it's nice from the patient's perspective to say, okay, your appointment will be ready in 15 minutes. And then one of the things that I really like about some of the more common programs today is you can have two-way communication reminders to confirm or reschedule an appointment. And it's literally you'll receive the text, and again, I have personally received those where you'll get it, and it'll say press 1 to confirm, 2 to cancel. Now, you may not be able to easily reschedule the appointment, but at least you can say, yes, it's confirmed, or no, I want to cancel it, which could trigger a phone call or trigger a second communication to get the patient re-engaged in your practice. So how does it work? Through integration with your practice management software, the automated appointment reminder solution downloads the practice's appointment schedule and appointment list, contacts all scheduled patients via voice, text, or email, and posts the results directly into the appointment detail area of the system. You can also take further integration depending upon the solution where tasks can be assigned for all calls where problems were encountered, such as a disconnected phone number. You will have those where those messages will come back, and if it's a good system, it'll actually send a task so that you can follow up and see if you can track the patient down. In my earlier slide, I mentioned two-way communication. This is something that's becoming more and more common with the systems that are out there, and we'll talk a little bit about that. This solution doesn't just allow your practice to communicate with your patients, but it also allows your patients to communicate back. Patients can notify the practice that they're keeping the appointment. They may need to reschedule, cancel the appointment, or would like to speak to someone at the office. If it's triggered from a phone call, your patients can press a button to be instantly connected with the office. That's really effective if you get a live voice, but if you're getting a voicemail, that's not going to help you too much. So that's one thing to keep in mind if you're considering this, because you want to look at the cost associated. Text messages are more common and where I've seen them, so you can see your patient's text messages in your reply and your report. So it'll say that they have confirmed, rescheduled, or canceled, as in the screenshot that we have on display right now. And then emails, your patients can confirm their appointments right from their email. Again, in this mobile technology, if they're looking at their emails, they can also do that, and that can be more of a real-time solution, just such as text. In my opinion, text messaging right now is by far the most real-time communication that you can have with a patient today if you're looking at any type of two-way communication. We've also mentioned a couple of slides earlier, the adjusted time messaging, and I think everyone understands that because I was sort of elaborating on it as we went along. But this type of appointment reminder will send a voice or text message to the patient a few hours before their appointment time. If the appointment's very early in the morning, the reminder is sent out the night before. I've had experience, believe it or not, I use a lot of examples with my hair salon. They seem to use this type of messaging very, very effective. I get one 24 hours in advance. I get one 6 hours in advance, and then I get one 30 minutes in advance. And I will tell you, a lot of times that can get a bit annoying, so you want to be careful. With that said, I rarely miss an appointment, or I would never forget to call and cancel if I were looking at doing that. And it sometimes will remind me that maybe I have something else to do and I need to take care of that. And the same thing I think applies in a medical practice. It allows the practice to set a number of hours prior to an appointment to send these reminders. The practice can also designate the earliest appointment time. They will start sending reminders in the morning versus the night before. Again, mentioned in the previous bullet, if a patient has an appointment at 8 o'clock in the morning, you're going to want to send that the night before to get them ready, as opposed to trying to send it at 6 in the morning. That wouldn't make a lot of people very happy. So to put a specific example, my practice sends reminders 2 hours before the earliest appointment time, being 10 a.m. for reminders. And so in this case, John Smith will get a reminder at 9 a.m. for his 11 a.m. appointment, but Betty Sue will get a reminder the evening before about her appointment at 9 a.m. tomorrow. And all of this should be in your control. It's very important when you're looking at systems to make sure you have control over what you're going to be giving your patients, and so that you can consider their specific demographics. No two practices are alike. Maybe similar, but no two practices are alike with your providers, with the way they function, or the hours that they set each day. So why would you consider this? Well, the first obvious reason is to reduce patient no-show rates and increase revenue. That's by far the biggest reason that people at least enter into this, but as you start using it, you will find other benefits. It will increase your staff productivity and allow you to operate more efficiently. It frees up your staff's time so they can deliver improved patient care, which is really what we're all about. I mean, that is the ultimate goal, I think, in any one of our day-to-day lives as we work in this industry, is improving patient care. It reduces expenses compared to manual calling and mailing. It's client configurable and patient customizable, and that's really important because, again, keeping your patients in mind, it allows you to be competitive and be able to work with each of your patients in the way that they best like to have their communications delivered. It utilizes the patient's preferred method of contact, telephone, text, and email, to remind patients of their appointment time, but not just to remind them of appointment times, to remind them that it's getting closer, or to remind them that they need to come in. And again, it's the word that we want to concentrate on here is preferred. Everybody has a different method of communication these days. It engages interactive communication with patients to increase their engagement and satisfaction. And confirmation messages are delivered quickly and inexpensively, and more importantly, and I'm putting this in a different order, accurately. Things can be made mistakes when you have people hand dialing. When you're mailing things, it could be delivered to the wrong address. It could be, numbers can be inverted. This really takes a lot of that away, and accuracy becomes very, very, almost 100%. We'll talk a little bit about client experiences, and we're going to talk first. A client out of Brookfield, Wisconsin, harnessed the power of automated appointment reminders to connect with patients. They were able to reduce no-shows by 83%. And then we'll move on to the facts. An MGMA study conducted on NextGen Healthcare clients found your practice could increase revenue by 15.8% to 21.7% just by using automated patient outreach. Again, you think obviously about the things that are real easy, being able to reduce the no-shows. But what if you can get more patients in for those flu shots? What if you can get more patients in for their follow-up visits? What if you can get a patient to follow up on their annual exam, in an OB-GYN practice when they have, they need to call, as opposed to sending those postcards or trying to get them to call, 90 days in advance. All of those things have a direct impact on revenue. And again, I'm always going to say it, patient satisfaction. Now, we talked earlier about population health outreach and how that can be combined into some of the campaigns and some of the reminder systems that you have. We're going to talk about this only as it relates to these types of systems. We all know on the call that there are numerous population health outreach programs, and some of them can be very basic all the way up to some really expensive systems, and they all have their benefits. But let's just talk about the basics. The key to a successful population health solution is rooted in the technology you use. And again, whatever you have, use it to its fullest capacity. By automating critical outreach to your patients based on population health initiatives or various health campaigns, you are, first of all, promoting patient adherence. And while we move from volume-based medicine to value-based medicine and macro, we all know this is going to become a real defining moment in our healthcare over the next several years. It's really going to have an impact on how you are paid. You can also target gaps in care, which is what this is all about. Where are the patients missing? Where are the breakdowns? For those of you who have hospital-based patients and patients that are staying in the hospital, by managing these items, you can reduce readmissions. And then finally, you can manage chronic conditions better. Let's get those hypertensive patients being taken care of. Let's make sure that they're staying on point when you possibly can. And utilizing these tools can actually help, and there are a lot of conditions and things that we can share that will actually show and demonstrate that this is proven. It is proven that these do help. So why does it really matter? As a result of initial patient outreach, one patient in particular, now I'm going to say this is an actual quote, and it was presented at the NextGen UGM about the a next-gen population campaign that was out, but we'll talk a little bit about this and just how it can help, and I think it really speaks for itself. Who was flagged as high risk, complained of chest pains while she was actually in the clinic. The patient stated she wasn't planning to show up for her appointment. Because of her outreach, we got her in the door. The patient ended up getting a heart catheterization within 24 hours. She had a 98% blockage in 2 major arteries, resulting in a double heart bypass the next day. This actually saved the patient's lives. Now, she had come in and she was flagged as a high risk, but that wasn't the reason for her appointment. But had she not come to the doctor at all, there wouldn't have even been any initial movement. So getting the patients in on a routine basis when they have a history of problems is always helpful. And so many different methodologies allow you to utilize that and do that now. Why would you not at least want to consider it? We'll talk now about the patient satisfaction surveys that come with many of these systems. We all know that these are also becoming a real factor, and they're also becoming a real factor in your competitive sense. These things are available, so you want to know how your patients are feeling about you. So patient satisfaction surveys can provide you with a better view into your patient's experience with staff, procedures, facilities, and care. No organization can afford to disappoint your patients in this new consumer-focused healthcare environment. We all know about the surveys that are online, and when you Google and you come up and you see that 2 out of 5 stars, that we really don't want to have those items. Now, there's a lot you cannot do. There's a lot that cannot be done to avoid that. You're going to have that disgruntled patient who maybe comes in and they write something that isn't fair or justified or right. But if they're the only one writing it, then it's going to make it look a lot worse than if you had 100 and only 1 bad delivery. So you want to focus and drive patients to talk about your practice. And you want to allow patients to drive your practice's reputation, which is now easily accessible to patients throughout the Physician Compare website. And it's, again, going to be very, very prominent as we moved into the value-based arena through macro. Not only are these surveys good for your practice, but they're becoming mandatory under many different quality reporting programs. We've mentioned that. And as we move from volume to value-based care, a positive patient experience is vital to better health outcomes, and it's vital to the success of your practice. So how do they work? Patient satisfaction surveys can be automated and sent via email or text message. I think we've all received them. I'm going to go back to my stint at the urgent care center. As soon as I left the urgent care center, I had received my just-in-time messages. I had received everything. Don't even know what system they were using. It was just kind of one of those things that I needed to do, and I was kind of fascinated with how this was all working from their perspective. And as soon as I left, I got the satisfaction survey that looked very similar to what we're showing on the screen. Practices have the option to filter recipients by appointment types, days, and number of days since last surveyed, because if you want to do this, not in my case with just a one-time visit, but you may want to do this routinely with your patients. Well, if you're, again, I'm going to use the OB-GYN example. If you're in the final stages of your pregnancy and you're coming in every week, you're probably not going to want to get this every time you come to the office. So you want to have the ability to filter it and then take a look at who you're sending it. So if you see a different provider, maybe you want to base it on the provider, but you want to be able to customize the criteria so that you're getting a benefit of this and not annoying your patients as well. And that can be a fine line, and you want to make sure you have a system that allows you to do that and helps you to do that. As part of this, you can also do multi-question surveys. I've talked a little bit about just the one single survey, but now this is going to be more experience-based surveys. Request or send as links within an email or text. So you can still do it with a text, but it would have to be done with a link. The link points to an online survey with a token that identifies what survey to present to the patient. So this is just one example of how they work, but it can be based on items that the patient can complete the survey via a PC, laptop, other browsing devices such as a smartphone. But the patient will then click on a link to complete the survey. And you'll get the survey, one-question survey. So a survey can be any length. We talked about multi-questions. Now you can do it with one question. But a survey can be any length and ask questions about the quality experience, quality of care received, and open-ended questions asking the patient's opinion. Now, this is by far the most common, and we've talked a lot about that. The multi-question, though, I'm kind of liking to explore that because you can get into more detailed information about not just what the patient has, but what the patient is looking for. What can we do to serve you better, and maybe even get into some healthcare questions as you want to get into that, as you get into more of the patient outreach. So we can talk a little bit more about that in some future webinars because we've got some other items and other tools that are coming available for these multi-question surveys. But the one-question survey seems to be the most common today, and that's something that can easily be deployed. And then we are going to talk a little bit about the old standby, the patient letters and cards that can be electronically generated and used for purposes such as recalls, appointment reminders, budget and collection letters, birthday wishes, general announcements, and holiday greetings. These are all standards, and many of you, I'm sure on the phone call, have done this for years. whether you had the patient. I've been in systems, probably telling my age, where I would go in and they would hand me a card and I would put my name and address on it, and then as soon as my appointment was over, they would put it in a file and they would send them out in the mail, 14 days before it was time for me to reschedule an appointment. All of these now can be handled electronically, whereas the patient will still get a paper letter, they'll still get a paper appointment reminder, they'll still get those budget and collection letters, but your company that you're working with, whether it's your EDI company or whomever it is, will be able to do these for you as opposed to you relying on your staff to be able to get those out. And many times it's going to be a lot less expensive than what you're spending on stamps, paper, printing supplies, and then the staff time of actually getting the letters out. And you can take advantage of some things that you may not be doing today. Birthday wishes, holiday greetings. I really like to get those cards from my vendors and practices. I like to know that people are thinking about me and that they take the time to at least send something out and let them know that they value my business. Because this is a business. It's a very important business, but it is a business, and these are all ways that you can keep your patients engaged. Now we're going to move into online scheduling, which is one of the probably the biggest areas where that we have a lot of angst. People are worried about it, but they're also very anxious, and it is becoming an expectation of the millennial generation. So we'll talk a little bit about options available to you and some real-time experiences. Patient self-scheduling is an integral part of daily operations for healthcare professionals and their practice management teams. It's a patient's first interaction with a practice, and it is essentially the start of the patient's experience and relationship with the provider. So whether they're making that phone call or whether they're doing it online, this is the first time they're dealing with you. And a lot of times in today's environment, there's not a lot that can be done to help it. Patients are calling and they're on hold, and they're on hold. And then traditionally the medical office staff scheduled appointments by communicating with patients over the phone or in person. However, now many practices are considering another option, patient self-scheduling. And this methodology allows the patient to schedule their own appointments through an online portal or software. Now, I can tell you right now, we have a number of practices that are using this, and it has, while there's been great success, the trepidation in the beginning was immense. What if they schedule the wrong appointment? What if they schedule the wrong provider? What if they schedule themselves too far out and they needed to come to the provider today? What if the provider gets overbooked and he gets angry or she gets angry? What if they don't meet the schedule? All of those things were presented, and they were things that truly did have to be overcome. But industry pressure has kept us moving along. There are patient engagement initiatives. Patients are now consumers. Their satisfaction is important. Their convenience is important, and it's a competitive market. And they expect technological innovation. They expect to be able to go online and schedule an appointment with their provider when they can go online and schedule an appointment with to get their hair done, to schedule an appointment for their massage, to be able to schedule an appointment online to have their air conditioning fixed. It is becoming so prevalent in the industry right now to be able to do online scheduling no matter what you're looking for. We have to be able to face it, and patients do expect it. So what is the current state of self-scheduling? Accenture published 2 studies in which they found 77% of patients prioritized booking, changing, and canceling appointments online as important, 77%. Patients today spend an average of 8.1 minutes scheduling an appointment, and 63% of the time their calls are transferred. Those are real statistics, and it can be very annoying to the patient. As we look at the future, that's where we are today, but they also predicted by 2019, 66% of health systems will offer self-scheduling. 64% of patients will use self-scheduling. 2 out of 3 health systems will adopt tools to book appointments online, and 38% of appointments will be self-scheduled, which is about 986 million appointments, creating $3.2 billion in value. These are just all independent studies, and it's something we need to consider. So if you look at online scheduling options today, there's numerous ones out there. We've looked at it. We've looked at many of them. You can do this through a third-party website. You can build your own. not probably recommended, but I've seen people do it. And then you can do it through your EHR portal. We're going to talk a little bit about the portal and some of the other options that you can do. A lot of the portal systems now allow you the ability to request an appointment. So practices can choose if a patient has the ability to actually schedule an appointment or if a staff interaction is necessary. The most common one today is the patient can submit an appointment request by selecting a preferred date and time, and then they must wait for a response from the practice with the actual day and time. So what happens, we've also, if any of you are using this within NextGen, and there's a number of other systems, my primary care doctor has this, and they do not have NextGen, but it's the same way. I can basically go in, I can put in a request, and then someone looks at it, and they will either email me back through the portal, or they will call me and tell me, yes, this works, no, it doesn't work. If it doesn't work, then we do this, and we go with this back and forth kind of thing. And it works, frankly, better than a phone call because I can do, I can put my request in at whatever time is convenient for me, but it still requires that back and forth interaction, and it's certainly not instantaneous like some of the other things that we've, other examples that I've given in other industries. Or we can move forward, and a patient can book an appointment themselves by finding and selecting an available date and time, and that's also known as real-time booking. And more, that is becoming the preferred methodology, at least from the patient's perspective. It's hard to understand why, with all the technology in healthcare, that we can't do this. So why should we consider this? Again, outside of the things that we've already talked about, building patient loyalty. Patients want to do it, and they're asking for us to allow this into our technology. It'll increase rebooking. Making it easier for patients will actually allow them to make their appointments when they would have to make a phone call. During the day, it's very hard for me to call anything. I will tell you, I try to schedule certain things, and being able to do it online, it actually improves my ability to get in, so therefore I'm more likely to visit the business. It improves attendance. When patients make the appointment themselves, they have a tendency to keep the appointment themselves. It promotes high reimbursements, and I'll explain that a little bit more when we get to the end of the list. It increases your online presence, which again is important in that Google search, and it's also going to be important when attracting new patients. It maximizes your availability. It strengthens your reputation, and it makes you available to the patient 24/7, at least for the purpose of scheduling. And by being able to self-schedule, depending on the system, it will also allow you to get verified reviews and be able to ask people, how do they like that? How do they like the scheduling functionality? And then being able to publish that. Kind of going on back to the high reimbursements, what some of the statistics have shown is that when you have patients that are self-scheduling, they are going to have a tendency to be insured patients. They're going to have a tendency to be more technology savvy, which indicates that they're probably going to be a younger, more versatile patient that's going to be seeing you for a long time. That's not to downplay the importance of other patients and being able to do this for others. We don't want to ever make this all about the money, but that's the reason this bullet is here, because it actually has been proven that patients who have choices and are busy and have a lot of things going on in their lives want to be able to do this, and in turn typically will be able to pay. So what are the advantages? Well, the patient appointment has been scheduled and the practice has been notified without a single phone call, regardless of which one you choose. No one has typically had to make a phone call. It's all been done. Less time was spent on the part of the practice and the patient. There was no time spent on hold. The request was not limited to the practice hours, as the patient requested the appointment at its convenience and the practice responded at its convenience. The entire transaction has a history at the patient level and the practice level, eliminating questions or confusions. Remember, this is all being done electronically, so those days of, well, that's not what I heard, or this is not what I said, has actually gone. You now have an audit log, and it decreases no-show rates. As before, we're just going to share some real-life results. We will talk about some things. One average found that the average phone call to schedule an appointment took 4 minutes and 40 seconds. After implementing their own web-based scheduling system, they were able to cut phone call times down to 2 minutes and 1 minute and 30 seconds to manually book those appointments. This takes 1 minute and 10 seconds off the average phone call duration for patient scheduling, saving the practice time and improved efficiency. And this is an actual statistic that one of the clients we worked with who had implemented this saw in their phone room. And think about the savings if you look at this and you model this by the number of calls that you take every day. To continue on, patient access is huge. Patients need to be able to be seen right away. This web-based patient scheduling was a pivotal strategic move to allow patients to make appointments in real time. We've been very successful and have scheduled 25,000 plus appointments this year year to date with this new software. That's a direct quote from one of the clients who actually implemented one of these systems. And these are different systems that we're talking about. But all of them have seen very, very positive experiences. So now we're going to focus, we're getting kind of to the end of the webinar, so we're going to jump through this a little bit. Even though this is, more financial based, we're going to talk a little bit about electronic patient outreach for revenue cycle management. There are some functionality and capabilities in many of the systems you're looking at today that weren't there before, or that you maybe didn't think about using your online patient messaging systems to assist you with. So healthcare as a business, while the focus of healthcare is on providing a positive patient experience, we've mentioned that many times throughout the webinar, we also can't forget the business aspect. I've also mentioned that. Minimizing the financial impact of outstanding patient balances is crucial to the success of any healthcare organization, no matter what its size, but reaching patients is only half the battle. With these systems now, you can actually incorporate automated collection reminders. Collections have proven to be one of the most challenging areas for healthcare providers. No one really likes to do it. Automated collection reminders perform a vital function that can oftentimes be an uncomfortable task for the office staff. You can take this out of your staff's hands because you can quit making those uncomfortable calls. You can collect past due balances faster, and you can increase the patient response. And these reminders can also be automated to print and mail. And what should we say? We have a note off to the left. Prior to implementing this feature, patients must give written consent to allow these reminders to be sent in compliance with federal regulations. So this is not something you're just going to put in and think that it's easy, but it is something we at least wanted to mention because this is newer technology and using technology to our advantages. Automated paper statements. These automated solutions to process, print, and mail billing statements. This benefit includes reduced costs, accelerated patient payments, increased operational efficiencies, reduced staff workload, and decreased errors. And for those of you who have portals that are working on different things, you can actually use your portals to also allow patients to obtain their statements, and in many cases take it further, pay online. And again, just a different method of patient outreach. And I can tell you personal experience, I like getting my statements electronically, and I like being able to pay without writing checks. I can't tell you how the last time I wrote a check, and I hope that if, as things go forward, I don't have to at some point ever do it again, and I think we're going that direction. So if you're not doing automated statements through, not just through your EDI company, but also considering portal and other methodologies to deliver this, it's just something you need to be looking at. And if you're looking at paper statement features, you can, I'm not going to get into all of this. These are all choices that you can make, but you can look at, the type of stock. You can look at colors, which has been proven to be important, logos, remit envelopes, first-class mailings, couponing, if you're getting into that, bad address reporting, and fast forward with address corrections. These are all functionality and features that your company should be able to offer for you. And automated electronic statements, what are the benefits? Well, again, we talked reduced paper, reduced costs, and quick links to payment options. We've covered all of those, and that's something that, again, to take a look at as you're considering these if you're not already doing this. Real-time services. Real-time transactions allow practice to check patients' benefits using real-time submission. Now, we're using real-time services when RTS is the next-gen statement, but there are many, many systems out there, so, there's not a lot of ways to describe this other than our real-time services, but there are, there's different things that you can use in addition to the next-gen services. But what this allows you to do is you can do patient eligibility verifications, referral authorization and pre-collection status, and claim statuses on claims that have already been sent. Depending on the system you use, this provides a real benefit to you with some of the very high deductible plans that are in existence today. And as we move more again towards the value-based versus volume-based, those plans are going to become more and more prevalent. There's even self-pay eligibility verification, and this is an automated method for checking third-party coverage on self-pay patients. This allows you to select a group of patient encounters from your practice management system and check Medicaid, Medicare, and or third-party liability coverages on them. So if they are self-pay, you can actually check if there's any other coverages available. And if desired, a note can be created for each encounter checked, and where coverage is found, a task for that encounter is created, prompting users to bill the encounter to the appropriate party. One situation that I encountered using a system such as this, it was a mistake. Sounds like just in terms of, I was at a particular office getting an annual, getting a standard exam, nothing important, but a lab was done, which is a standard lab, but somehow when it got, transmitted through the EHR, my insurance didn't pass, so somehow I got flagged that it was a self-pay. I received basically notifications asking me if there's anything that I could help with this, and I was just called and said, I don't need any help, but here's my insurance. But those type of things will allow you to catch those things, even mistakes, and in this case it was a mistake, but those type of things allow, and when you have those in place, it keeps your revenue flowing, and it also keeps the patient happy because their coverage is always intact. We'll talk a little bit about a client experience here. The patients who received automated reminders in the practice were much more likely to pay their balances than those who elected not to receive automated outreach. I think that's probably a true statement and maybe a pretty obvious statement. With that said, it's still something that I think is beneficial because many times things just slip people's mind, particularly in the world of electronics. So it's a good idea to at least consider these options and make it easier for the patients to know that they have a payment due. Finally, as we talk through this, a satisfied customer is the best business of all. There are a lot of statistics that you can have one dissatisfied customer who can provide such negative publicity and negative feedback that it will outweigh 100 satisfied customers. So it's very, very important. So let's focus on keeping our customers satisfied, and by staying in tune with technology today, that is the best way to do that. So uncertain where your practice stands, let Itentive help. We can assess your current readiness. We can provide recommendations. We can assist in the implementation of new processes and procedures. As we move towards MACRA, we also are offering 3-tiered MACRA support packages, fundamentals, intermediate, and expert packages. We let our experts help you if you're having trouble navigating these waters. And then if you're interested in any next steps, you can visit us at itentive.com. You can sign up for our webinars and blogs. You can consider the 3-day fixed price on-site consultations. And you can test drive one of our products, Refund Manager and ChartGuard. So now as we move forward, let's talk about questions, if there are any questions about the webinar material we provided today.
Great. Thank you so much, Cindy, and thank you, Lindsay. Again, questions can be entered in the questions area of the GoToWebinar control panel, and we're just going to do them in the order that we receive them. It looks like we only have 2 right now, so please feel free to type in your questions, and I'm sure that we'll be able to get to them all. So first questions. When it comes to choosing options for reminders, can we mix and match texts, calls, and emails?
Yes. Absolutely, and in fact, many offices choose to do all 3. So they will email the patient, they will call the patient, and they will text the patient.
Great, thank you, Cindy. Next question, how do we get notified if the patient confirmed an appointment?
That's going to vary depending on the system that you use. Ideally, it would be in your practice management system, and it would come back that the patient has confirmed. If the patient canceled, you would have a report that the solution is providing you. Again, it can vary from system to system. Some are very sophisticated, and some are simply just that you would receive a report.
Great, thanks, Cindy. And just to answer a couple of similar questions, we will be sending out emails with a link to the recording as well as a downloadable copy of the slides if you're interested in those. And we'll be sending those out within the next week. Looks like another question came through. Are these programs already on NextGen?
All of the ones that we presented here today do work with NextGen. All of them do. They're not all NextGen based products. There's a mix and match here. Some of them are NextGen products. Some of them are third-party products. All of them do work with NextGen, and all of them we have had real-time client experiences with. So we can, I would say, vouch for them.
Okay, great. Well, thank you, Cindy, for the presentation. Lindsay, thank you as well. And everybody who attended, thanks for taking the time out of your busy day. Hope that it was helpful and informative. And please feel free to let us know. You see Cindy and Lindsay's information up on the screen. Feel free to reach out to us with any questions. We really look forward to helping you, and have a great day. Thank you, everyone.
Bye-bye.
Bye, thanks.